Welcome back to the Deep Dive, everybody. Today, we're diving into a really, really important subject and one that's going to be super relevant for all of you future LPNs out there. We're going deep on nutrition across the lifespan.
Yeah, a very important subject as you grow in your practice and see patients of all ages and backgrounds.
Exactly. So think of this deep dive as your ultimate, nutrition review session, right? We've gone through tons of research from, pregnancy and infancy all the way to adulthood and older adulthood to really pull out the most crucial information that you need to know, especially for those of you studying for the LPN exam.
Yes, think of this as your focused guide to the core concepts of nutrition and how they apply across different life stages.
Perfect. Yeah. We're going to strip away all the extra stuff and give you the core, the essential nutrition knowledge that you're going to need. So are you ready to dive in?
I am.
Awesome. All right. So let's start at the very beginning. Even before a pregnancy begins, pre-pregnancy nutrition is really a big deal, right?
Yeah. It is, yeah. Making sure a woman is properly nourished even before conception can make a huge difference. And one of the key things here is folate. We always talk about folate during pregnancy, but even in those months leading up to it, it's absolutely essential.
That's really interesting. So why is it so important even before pregnancy?
Well, think of it this way. Folate plays a crucial role in cell division and growth, right? And that's especially important during the very early stages of fetal development, like when the neural tube is forming, which eventually becomes the baby's brain and spinal cord. Low levels of folate can significantly increase the risk of neural tube defects, which can lead to serious birth defects.
Oh, wow. Okay, so adequate folate intake before pregnancy is like laying the foundation for a healthy baby. It's almost like setting them up for success from the very start, right?
Yeah, that's a great way to put it, yeah.
Okay. So now let's talk about what happens when pregnancy actually begins. I mean, it's obvious that the nutritional demands would go up, right? You're growing a human. There's so much development happening.
Absolutely. And it's not just the baby growing. The mother's body is working overtime, to support that growth. You have the placenta developing, the uterus enlarging, amniotic fluid, blood volume increasing, and even, the breasts are preparing for breastfeeding. All of this requires more nutrients, more energy.
Right. Makes total sense. Okay. So when we talk about calories, what kind of increase are we looking at during pregnancy?
Well, the recommendations are pretty specific. In the second trimester, pregnant women need about an extra 340 calories a day. And that goes up to about 452 extra calories per day in the third trimester.
Oh, wow. Okay, so it definitely increases as the pregnancy progresses.
Exactly.
All right. So obviously, it's not just about eating more, right? Those extra calories need to come from nutrient-rich sources. So what kind of dietary advice do we typically give to pregnant women?
The dietary guidelines for Americans are a fantastic resource here. They recommend, a variety of fruits, vegetables, whole grains, low-fat or fat-free dairy, lean protein sources like meats, poultry, fish, beans, legumes, eggs, nuts, all that good stuff.
Yeah. And I think the dietary guidelines also have those 4 fundamental principles, right, that apply to every life stage.
Absolutely. They do. They're a great roadmap for healthy eating habits no matter what your age. And that includes, breastfeeding as the preferred method of feeding for about the first 6 months of a baby's life.
Oh, that's right. Okay. So lots of good stuff packed in there. And, we talked about calories, but weight gain is also, something that's top of mind during pregnancy. And it's not just a free pass to eat whatever you want.
It's definitely not.
Yeah. So how much weight gain is generally considered healthy?
Well, the recommendations for weight gain actually vary depending on the woman's pre-pregnancy body mass index, or BMI, which is a measure that takes into account height and weight. For women with a normal BMI, a gain of about 25 to 35 pounds is typical, but for those who are underweight, they might be advised to gain a bit more, while those who are overweight or obese might be advised to gain a bit less.
Oh, that's interesting. So it's really individualized. Okay. So we've talked about pregnancy, but what about after the baby is born? If a mother chooses to breastfeed, her nutritional needs are obviously still going to be pretty high, right?
Absolutely. They are. She's now, providing all the nourishment for her baby through her breast milk.
Right. It's literally food production going on.
Yeah.
So what are the calorie recommendations during lactation?
Well, for the first 6 months, where breastfeeding is usually exclusive, an extra 330 calories per day is recommended. And that bumps up slightly to 400 extra calories a day in the second 6 months when, babies are starting to eat some solid foods.
All right, that's interesting. So the needs actually increase a little bit later on. Okay, so we've talked about energy needs, but let's talk about some of those, those major building blocks: protein, carbs, and fat. What are the recommendations there?
So protein is super important during pregnancy and lactation.
Mm-hmm.
The dietary reference intake, or DRI, so that's basically the recommended level is about 71 grams a day. And that's, for building tissues, for the baby, for the mom, for amniotic fluid, for blood volume expansion.
Wow. Okay, so lots going on with that protein.
A lot going on, yes.
All right. What about carbs and fat?
Carbohydrates should make up about half of a pregnant woman's daily calorie intake. They're the primary source of energy. And what's really important is that enough carbs ensure that the protein that she's consuming can be used for building the baby's tissues and, for all those other important functions. The body won't have to break down protein for energy if it has enough carbs. And fat, that should be about 30% of her daily calorie intake. And that should mostly be healthy fats like, unsaturated fats.
Okay, so lots to keep in mind there. And then, of course, we can't forget about all those essential micronutrients of the vitamins and minerals. There's a whole bunch of them, right?
Oh, there are. And the need for most of them does actually increase during pregnancy. But two that we always highlight because they're so crucial are folic acid and iron. You already mentioned folate, but during pregnancy, women need about 600 micrograms a day. And it's super important for preventing those neural tube defects.
And it's amazing how much of a difference it makes for the developing baby.
It does. And then there's iron. The DRI for iron increases by like a whopping 50% during pregnancy.
50%. Wow. Okay, so that's a lot. What's all that iron needed for?
It's mainly to support the increased blood volume, in the mother's body, and it also helps to build up iron stores in the baby's liver. And good sources of iron include meats, eggs, leafy green vegetables, fortified breads and cereals, dried fruits. And one thing that's helpful to remember is that vitamin C can actually boost iron absorption. So eating iron-rich foods with something like citrus fruits or bell peppers can really make a difference.
Oh, that's a good tip. Sometimes it's those little things that can make a big difference. All right, so we've covered the main nutrients. What about any other general dietary recommendations for pregnant women?
Oh yeah, there are a few important things to highlight. First, hydration is key. Pregnant women should aim for about 2,000 to 3,000 milliliters of fluid every day. And that's from water, juice, milk. And, it's best to limit sugary drinks like sodas and, those fruit drinks because they don't really offer much nutritional value. Alcohol, that's a big no-no during pregnancy, right? Yeah. No amount of alcohol is considered safe. So complete abstinence is really the best approach.
Yeah, that's one that we definitely stress as healthcare providers. And what about caffeine? Is that okay?
Moderate caffeine intake is usually fine. Under 200 milligrams a day is generally considered safe. But it's always, a good idea to talk to your doctor about what's right for you.
Right. Okay. What about fish? Isn't fish supposed to be really good for you? But then there's that whole mercury thing.
Exactly. Fish is a great source of omega-3 fatty acids, which are super important for the baby's brain development, right? But some fish do contain mercury, which can be harmful. So it's all about choosing the right kinds of fish and eating them in moderation. Albacore tuna, that should be limited to about 6 ounces a week. And fish that are high in mercury, like swordfish, king mackerel, tilefish, shark, those should be avoided completely.
Okay. So being selective and staying informed about the latest guidelines.
Exactly. And the overall recommendation for seafood is about 12 ounces a week. And of course, there are pregnant women who choose to follow a vegetarian diet. And a vegetarian diet can absolutely provide all the nutrients they need as long as it's well planned and includes a good variety of plant-based protein sources.
Perfect. Okay. So we've covered a lot of ground here. But, pregnancy isn't always smooth sailing when it comes to, food. We see things like nausea, constipation, right? That can be pretty common.
They are.
So as a future LPN, what are some ways that you can help pregnant women who are struggling with these issues?
So for nausea, which is often called morning sickness, even though it can happen at any time of day, there are a few things that can help. Eating dry crackers or toast before getting out of bed can be helpful. Sometimes salty or tart foods can ease nausea. And it's often a good idea to avoid triggers like strong smells or fatty foods.
Oh, yeah, that makes sense. Anything else?
Separating fluids from meals can also help, so don't drink too much while you're eating. And, if they're really struggling, there are some medications that can help. But of course, it's important for them to talk to their doctor before taking anything.
Right. Always consult with the doctor first.
Exactly. And for constipation, increasing fluid intake is key, as is fiber. So make sure they're eating plenty of fruits, vegetables, whole grains. And if their doctor approves, light exercise can also help get things moving.
Got it. So those are some common issues. Are there any other unique dietary situations that we need to be aware of?
Well, one that comes to mind is maternal PKU. That stands for phenylketonuria. It's a genetic condition where the body can't break down an amino acid called phenylalanine.
Oh, right. PKU. I remember learning about that.
Right. And it's important to remember that for women with PKU, maintaining a very strict low phenylalanine diet is crucial. It's actually something that they need to start even before pregnancy, ideally 3 months before conceiving, and continue throughout pregnancy. And it basically means avoiding high-protein foods because those are the ones that contain phenylalanine. And close monitoring of their blood levels of phenylalanine is also essential.
Wow. Okay, so that's a really specific dietary restriction, but it's clearly so important for a healthy pregnancy.
It is. It is.
Okay, that's a lot to take in about pregnancy and lactation. Let's move on to the next stage, infancy, which is basically that first year of life. And I think it's safe to say that it's a time of incredible, really rapid growth, right?
Oh, is. Infants grow faster than at any other time in their lives. Their birth weight typically doubles by around 4 to 6 months and triples by the time they're a year old. It's amazing to see.
It really is. Okay. So given all that rapid growth, what are the main feeding recommendations for infants?
So the American Academy of Pediatrics, or AAP, strongly recommends exclusive breastfeeding for the first 6 months. And then, continuing breastfeeding for up to 2 years or longer if both the mother and the baby are, happy with it.
Okay. And what about situations where breastfeeding isn't possible or the mother chooses not to?
In those cases, iron-fortified infant formula is the recommended alternative. But whether an infant is breastfed or formula-fed, it's important that they get enough vitamin D, and that's especially true if they're not getting, at least 28 ounces of breast milk or formula a day.
Right. Vitamin D, super important for bone health.
Very important, yeah.
Okay. So, when do we usually start introducing solid foods to babies?
We usually wait until around 6 months of age.
Oh, 6 months. Okay. Why 6 months?
Well, there are a few reasons. First, their digestive system is more developed at that point.
Mm-hmm.
Second, they usually have better head control by 6 months and they can sit with some support. And finally, they develop that tongue thrust reflex, which actually helps them push food out of their mouth if they're not ready to swallow it.
Oh, that's interesting. So it's all about their development, making sure they're ready.
Exactly. And around that 6-month mark is also when their iron stores from when they were in the womb start to deplete. So iron-fortified cereal is often one of the first foods that we introduce.
Oh, that makes sense. So what about things like cow's milk? When can babies have that?
Cow's milk actually shouldn't be introduced until after a baby's first birthday.
Really? Okay. Why is that?
Well, it's just too much for their little systems to handle. Cow's milk is high in protein and minerals, and their kidneys aren't mature enough to process all of that yet. And they can't fully digest the fat and protein in cow's milk either. Plus, breast milk is specifically designed to meet their needs in a way that cow's milk just isn't.
Oh, that makes sense. So, so sticking with breast milk or formula for the first year, got it. All right. Focusing specifically on breast milk, what are some of those key nutritional advantages that you might highlight to new parents?
Oh, breast milk is amazing. It's so much more than just calories. It provides antibodies that protect babies from infections. It's easy to digest. It's got the perfect balance of nutrients. It's low in sodium. It's got easily absorbed iron and zinc, and the ratio of calcium to phosphorus is ideal for strong bones.
Wow. Okay. So it really is nature's perfect food.
It is.
All right. So for mothers who choose to breastfeed, what are some things that we need to teach them about breastfeeding successful?
Well, first of all, it's important to start breastfeeding as soon as possible after birth, ideally within the first hour. And frequent feedings are key, 8 to 12 times a day, at least in those early weeks.
Yeah.
It's really all about supply and demand.
Oh, right. So the more the baby nurses, the more milk the mother produces.
Exactly.
Right. What else?
And moms should be encouraged to feed on demand, rather than on a schedule. It's all about paying attention to the baby's cues, like rooting, sucking on hands, those kinds of things. Crying is actually a late hunger cue. And babies might nurse for up to 15 minutes on each breast, especially at first. And they'll usually show signs that they're done, like their sucking will slow down, the breast will feel softer, they might fall asleep. Over time, they'll get more efficient at draining the breast, and feedings might be a bit shorter. And unless there's a medical reason, newborns don't typically need any supplements.
Got it. And sometimes babies have trouble latching on, or maybe the mother has to go back to work. So, what about pumping?
Yeah, pumping is a great option in those situations. Moms can express their milk and then store it for later use. And it can be stored in the fridge for up to 4 days, or in the freezer for up to 6 months.
Oh, wow. So it can actually last a while if it's stored properly?
It can. And of course, there are specific guidelines for thawing and warming breast milk to make sure it's safe.
Right. All right. And just to touch on formula feeding, what are the main points there?
Okay. So if the family chooses to formula feed, we recommend an iron-fortified infant formula for at least the first year. And fluoride supplements might be needed depending on the local water supply. It's also super important to follow the mixing instructions precisely. Incorrect dilution can actually be harmful to the baby.
Oh, wow. I hadn't thought about that.
And just like with breast milk, there are guidelines for storing and preparing formula. And we always encourage parents to hold their baby during feedings, rather than propping the bottle. That helps prevent, ear infections and choking.
Right. It's about that bonding time too, right?
Exactly. And burping. Don't forget to burp the baby.
Oh, yeah, that's important. Okay, so we've covered, breast milk and formula. What about that transition to solid foods? There's a lot to cover there, right?
There is. So first of all, we look for signs that the baby is developmentally ready for solids, which is typically around, 6 months. Can they hold their head up? Can they sit with support? Are they showing interest in food? Things like that.
Okay. Makes sense. What else?
And we start slowly, introducing one new food at a time every 3 to 5 days, so that if there's an allergic reaction, you can easily pinpoint which food caused it.
Oh, right. So that makes it much easier to figure out.
It does. And by around 8 months, a lot of babies can be eating 3 small meals a day, plus, a couple of snacks. And homemade baby food is totally fine. Just, make sure it's not too salty or sugary, and store it properly.
Perfect. And of course, there are those foods that are choking hazards, right?
Yes, definitely. So things like, whole grapes, nuts, hard candies, raw carrots, tough meats. Those are all big no-nos. Cut everything into, small bite-sized pieces that they can easily manage.
All right. Great advice. Now, just like with any other stage, there are those potential nutrition-related problems that can pop up in infancy. What are some of the things that we might see?
Colic is a common one.
Yeah.
It's that excessive, inconsolable crying that, some babies experience. The exact cause isn't really known, but sometimes it can be related to, something in the mother's diet if she's breastfeeding. So things like cruciferous vegetables, cow's milk, caffeine, chocolate, those can sometimes be triggers.
Interesting.
And lactose intolerance can also be an issue. For some babies, that's where they can't digest lactose, the sugar in milk.
Right. And how do we manage that?
Well, often the pediatrician will recommend a soy-based formula or a casein hydrolysate formula. And of course, if the baby is breastfed, the mother might need to make some dietary changes herself. Okay.
Anything else?
Failure to thrive is another concern that we see sometimes. And that's when a baby isn't gaining weight or growing as they should be.
Right. That sounds serious.
It can be, yes. So in those cases, we really need to figure out what's going on. Is there an underlying medical condition? Are there feeding difficulties? And often a high-calorie, high-protein diet is recommended.
Oh, wow. Okay. What about diarrhea?
Diarrhea can be caused by, a number of things, like overfeeding or food intolerances or even infections. For mild cases, it might just resolve on its own. But for moderate diarrhea, oral rehydration solutions are really important to prevent dehydration.
Oh, right. Yeah.
And we always encourage mothers to continue breastfeeding, even if their baby has diarrhea. And for formula-fed babies, they usually don't need any special formulas unless, the doctor recommends it.
Okay, good to know. What about constipation?
Constipation in babies is, it's less common if they're breastfed, but it can happen in formula-fed babies, especially if the formula isn't mixed correctly. So, emphasizing those proper mixing instructions is really important.
Right. And what about, what kinds of things should nurses be assessing and doing, when it comes to infant nutrition?
Nurses play a really important role in educating parents about infant nutrition, about normal growth patterns and the right ways to breastfeed or formula feed and, introducing solid foods safely.
Perfect. All right, so we've covered infancy. Let's move on to childhood, which we can break down into toddlers, preschoolers, and school-age children.
Yeah.
And that rapid growth that we saw in infancy, that starts to slow down a bit, right?
It does, yeah. It definitely levels off.
Okay. So what are some of the general nutritional needs and considerations for these age groups?
Well, My Plate is a fantastic resource for understanding the dietary guidelines for this age group. They still need all the food groups, just like adults do, fruits, vegetables, grains, protein, dairy, just in smaller portions, of course. And the amount of food they need really depends on how active they are.
Oh, right. Makes sense.
Yeah. And this is actually a really important time for establishing healthy eating habits because kids' food preferences and, their attitudes towards food are really taking shape.
Oh, okay. So we can make a big impact during these years.
We can.
All right, let's start with toddlers, those little bundles of energy. What are some key nutritional considerations for them?
So toddlers, they're typically growing about 2 to 3 inches in height and gaining about 5 to 6 pounds a year. And they need a lot of energy, but it's important to make sure those calories are coming from nutrient-rich sources. And we want to limit juice, 100% juice, to about 46 ounces a day. And that's because it's high in sugar, and it doesn't really provide the same nutritional benefits as whole fruit.
Oh, okay, good to know. What about milk?
Whole cow's milk is still important for this age group, for their brain development.
Mm-hmm.
But we usually recommend limiting it to about 24 ounces a day because, too much milk can actually interfere with iron absorption.
Oh, interesting. Okay. So not too much milk.
Not too much.
All right. What about introducing new foods?
Oh, toddlers are notorious for being picky eaters.
Yeah.
Right. So, patience is key. It can take, multiple exposures to a new food, sometimes 15, even 20 times before they'll accept it.
Oh, wow. That's a lot. Okay. So persistence is key.
Persistence is key, yes.
All right. What else?
And it's best to stick with regular meal times and offer, healthy snacks between meals. Avoid giving them, sugary drinks, sugary foods, processed foods. And choking is still a big concern at this age. So we want to avoid those hazard foods like whole grapes, nuts, hot dogs, hard candies. And we need to make sure that they're sitting down when they're eating, not running around.
Oh, yeah, definitely. Safety first.
Safety first, always. And, some common nutritional concerns at this age are overfeeding, giving them too much food, too many high-calorie snacks.
Mm-hmm.
And we also see iron deficiency anemia sometimes. So we need to make sure they're eating iron-rich foods.
Right.
And lead poisoning is another concern, especially for kids who live in older homes where there might be lead paint. Lead poisoning can affect their development, so it's important to make sure they're getting enough calcium, iron, and zinc in their diet because those nutrients can actually help protect against lead absorption.
Oh, wow. I didn't know that.
Yeah. And vitamin D continues to be important. It's crucial for their growing bones.
All right. So toddlers, definitely a lot going on with them. What about preschoolers? What are some of the things that are unique to that age group?
Well, preschoolers, they're still growing pretty steadily, gaining about 2 to 3 inches and 5 to 6 pounds a year. And they need about 13 to 19 grams of protein a day. And if they're eating a balanced diet, they usually don't need any extra vitamins or minerals.
Oh, that's good.
But they do tend to have like stronger food preferences, and dislikes.
Oh, yeah.
And they go through these phases called food jags, where they'll only eat like a very limited number of foods for a period of time.
Oh, I've heard about those. Like they'll only eat like macaroni and cheese for a week or something.
But it's usually temporary. And their food patterns are really, influenced by their family and caregivers.
Yeah.
But peer pressure starts to come into play around this age.
Oh, yeah. Okay, so their friends start to influence what they eat.
They do. And, obesity is a big concern for this age group. So we want to emphasize healthy habits, limiting sugary drinks and unhealthy fats, and encouraging physical activity.
Yeah.
And if a child is overweight or obese, a weight management program might be necessary, but it really needs to be, guided by a healthcare provider.
Right.
And it's so important to focus on on healthy habits and praise their efforts rather than, using food as a reward or punishment,
Yeah.
that can really backfire.
Yeah, that makes sense.
And again, nurses can play a big role in educating parents and preschoolers about healthy eating habits.
Perfect. All right. So finally, we have school-age children, those 6 to 12-year-olds. What are some of the things that we need to be thinking about for this age group?
So school-age children are still growing, about 2 to 3 inches and 5 to 6 pounds a year. And their diet should continue to follow, those My Plate guidelines, making sure they're getting a variety of foods from all the different food groups. And, for kids who are active in sports or other physical activities, we need to make sure they're getting enough calories and protein to fuel their bodies.
Right. And they're also starting to make more of their own like food choices.
Yeah,
right.
They are. They're becoming more independent, so we want to educate them about how to make healthy choices.
Okay, so giving them those tools to make good decisions.
Exactly. And it's interesting because studies show that about 10% of school-age kids skip breakfast regularly. And that can actually impact their concentration and their school performance.
Oh, wow. I hadn't thought about that connection.
It's there.
Okay. And what about obesity in this age group?
Obesity is still a big problem. It can have a huge impact on their self-esteem and, their social lives.
Right. All right. So definitely a lot to think about for school-age kids. Okay, let's move on to adolescence, that time of huge physical, emotional, and social changes. And it seems like their nutritional needs would be like really important during this stage.
They are. Absolutely.
Yeah.
Adolescence is a time of rapid growth, second only to infancy in terms of how fast they're growing.
Oh, really? Wow.
Yeah. They go through these huge growth spurts, and their bodies need a lot of, calories, protein, calcium, iron, zinc, all of those nutrients that support growth and development.
Wow. That's a lot to keep up with.
It is. And the timing of these growth spurts actually differs between boys and girls. Girls typically start their growth spurt a bit earlier than boys, and they also tend to need a bit fewer calories overall because, they're not gaining as much muscle mass.
Okay, that's interesting. So there are definitely some gender